Hello, everybody. I am going to be introducing my toolkit here, going over hypertension in the dental office and the different tools I have created to help out the dental providers and the dental staff who are treating hypertensive patients in the dental setting. So first, a little overview of what I'm going to cover. So in this project and in this toolkit, I am including a blood pressure flowchart, hypertensive guidelines, a risk assessment, tracking forms, medical consult forms, and patient materials. I will be going over each of these in this video. So first, looking at the flowchart, and all of these toolkit items will be provided on a laminated sheet on a binder ring to easily be able to hang it in an operatory, wipe clean if need be, if it gets dirty or anything like that. So starting out first with the flow chart, as you can see, we start at the very top with seating patient quietly for 5 minutes. This is recommended by the American Heart Association anytime we are taking a blood pressure, anytime anyone's taking a blood pressure, as sometimes stress and outside factors can affect that reading. So by giving your patient 5 minutes to settle in and kind of relax a little bit, that can affect the reading significantly. So after you've done that, we want to make sure the patient is in proper positioning. So patient is sitting upright, feet flat on the floor. So we do not have them sitting back in the dental chair yet. We do not have them reclined or feet elevated just yet. And this is when we're going to initiate that first blood pressure reading. After you take that first blood pressure reading, we've got a couple different routes we can go down here. So first and foremost, you can see to the left, we have normal blood pressure. Again, when I say normal, I'm referring to the American Heart Association blood pressure guidelines, and we will get into those later as well. But normal is systolic of 120 or less and diastolic of 80 or less. So 120 over 80 or less for your patient's reading is considered normal. Once you have that normal reading, you can go ahead and proceed with treatment. So in this case, you are going to make sure you document that reading, even if it is normal, before you proceed. Now, the more seemingly complicated route is going to be with your patients who are not normal when it comes to their blood pressure reading. So in this case, if your patient's first blood pressure reading comes back elevated or hypertensive, again, according to the American Heart Association guidelines, then you're going to retake their blood pressure for a second time, usually letting them rest another 3 to 5 minutes, but sometimes that's not always possible in a dental office setting because the time just keeps on ticking. But letting them rest for a moment or two before replacing that cuff on their arm and taking their blood pressure again. So take that second reading. Again, document that second reading. Make sure you have that somewhere in your notes. And then we can go from there and determine, is the blood pressure still elevated, still hypertensive? Where are we at? So if it was just artificially elevated or hypertensive, then we hope to see that the patient's blood pressure will then drop on that second reading, and then we can continue with treatment. If that is not the case and their blood pressure actually elevates more or stays the same, then we're going to initiate a third reading. Upon this third reading, we are going to start thinking about making decisions on treatment that day and what needs to be done in the best interest of the patient. After that third reading, obviously, again, document that reading. It's so important that we have a record of this. After you've documented that reading, we are going to discuss this with the patient and discuss their readings with them, ask questions, and some of those questions, have a lot to do with the patient's medical history that you should collect prior. So if the patient's third and final blood pressure reading is still hypertensive or elevated, then we are going to refer to the guidelines, which I'll be going over next here, and the guidelines will help you in decision making for how to proceed. Just because a patient's blood pressure is elevated and slightly or even hypertensive does not mean we abort treatment, especially aborting a prophylactic appointment or a peri-maintenance appointment or something like that. Something where no local anesthesia, no epinephrine or anything's involved, no added major stress is involved. Usually, we're pretty safe to still proceed. Again, that's what the guidelines are for. That I'll be going over next. But at this point, we should start to think about educating our patient and about possibly having to do a medical consult for this patient. So this is what I was talking about. This is the hypertensive guidelines that I kept referencing from the flowchart. And these guidelines come directly from the American Heart Association based on the values, and then the dental management comes from the dental community and evidence-based research about what is safe and what is not safe to treat patients. So again, the readings are all categorized based on the American Heart Association's recommendations. So you can see the normal reading is less than 120 systolic, less than 80 diastolic, elevated, stage 1 hypertension, stage 2 hypertension, upper level stage 2 hypertension, and hypertensive crisis are all lined out there for you. And in a nice color coded fashion that I love, because we can usually see green means good, yellow means okay, we might have something to look at here. Orange, we're starting to actually slow down and think about it a little more. And red, obviously, is time to really take it seriously. So I want you to focus now on the very right-hand column under dental management, and I want to kind of go through these different categories briefly. So as you can see, normal, elevated, stage 1 hypertension, and stage 2 hypertension are all in the category of no contraindications to dental treatment. This is very important because we are still able to treat patients even if their blood pressure is 140 over 90 or 145 over 95. Not that this is ideal and not that this is healthy for the patient to have a blood pressure of such, but most likely that this patient is not experiencing a hypertensive crisis or something of that serious nature. More than likely, this patient has been hypertensive for quite some time, and they do need to seek medical attention for this, but it's not something that we should delay treatment for. Again, still we're going to educate the patient, and we'll get into the medical consult portion a little bit later. But patients often present with blood pressure in this range, in stage 1 or stage 2 hypertension. And it's not always due to something serious. It's not always chronic hypertension. A lot of times it's white coat syndrome, which we're all familiar with, and things like that. Or situational. Caffeine, we know caffeine, smoking, tobacco use, things like that can elevate it temporarily as well as long term. But that's why we're going to question our patient about those things as well and make note of it. So just because we had to retake a blood pressure 3 times in the flow chart does not mean we're going to delay treatment. We're taking the blood pressure 3 times to show due diligence that we were not neglectful in recognizing that the patient was not in a healthy, normal range when it comes to blood pressure. That is important for our own documentation and also for the patient to have those records as well. So the next category in that far right-hand column says defer elective treatment and refer to a physician as well as complete medical consult. So this would be when your patient is in upper level stage 2 hypertension. So that is the little orange category here. So this is when we do start to take a step back and pump the brakes a little bit because we possibly have a situation on our hands. So upper level stage 2 hypertension had to be kind of redefined because it used to fall into stage 2 hypertension, but now we've split the two and it's now upper level stage 2 because there's a difference between stage 2 and upper level stage 2 when it comes to the seriousness of the matter. So in this upper level stage 2 hypertension, your patient is going to be anywhere from 160 to 179 systolic blood pressure. Again, it's a range if they fall anywhere within that. Dystolic 100 to 119 reading. This is significant blood pressure reading, not out of the ordinary when it comes to the American population. And we know that based on research and the American Heart Association reports and the CDC reports that over 47% of Americans have hypertension. So not unlikely that we're going to run across this upper level stage 2. Not unlikely at all. In this case, we are going to defer treatment. This is not a safe level to treat a patient at, and we're going to for sure fill out a medical consult and refer them to their physician. Now, when I say defer treatment, we're deferring treatment after we have taken 3 consecutive blood pressure readings and 2 or more of those readings fall within this upper stage 2 range. So if your patient is borderline with hypertension stage 1 and upper level hypertension stage 2, and 2 of those readings fall within that upper level, we're still going to defer treatment. But we're not going to defer treatment just based on one single reading. That's why in the flow chart, it's 3 consecutive readings to determine a pattern. So when that happens, we have patient materials that I will also be going over shortly that you will give your patient to give them more detail on what's going on and what we noticed in the dental office and what they can do about that. And then here on the bottom, in the bright red, we want to look at this a little bit. So hypertensive crisis. So that's exactly what it sounds like. Your patient is experiencing a crisis, and this level of blood pressure, most of the time the patient will not feel well at all, but that's not always the case. I personally have had patients come in this range and report that they feel just fine. They don't understand why they can't get their cleaning. And of course, the proper thing to do and the responsible thing to do for that patient is to recommend that they either go to the emergency room, but I prefer to call 911 because in this case, I don't even want them driving themselves to the emergency room. So hypertensive crisis is when your patient's blood pressure is 180 systolic or higher, 180 or higher, and their diastolic is 120 or higher. This is some serious stuff. So I know a lot of people don't take blood pressure seriously. I know a lot of patients don't take it seriously, and this is something that they may be aware of, and they aren't seeking treatment for it. Nonetheless, as dental providers, we cannot just turn away and act like we don't know that this is a serious situation and that we're not going to do anything about it. So we are going to do something about it. We are going to call 911 and have the patient evaluated by the emergency room physician, and then hopefully eventually a cardiologist or their primary care physician for treatment, because there is something going on if a patient has this high of a blood pressure reading. This is not a fluke thing. And again, this is after taking 3 consecutive readings. So sometimes we can get a reading like this because we either have a cuff malfunction, machine malfunction, patient wasn't in the proper positioning, something's going on. That's why it's so important to make sure your patient's in the proper positioning. You've given them 5 minutes to relax. You've questioned them about caffeine intake, things like that. After 3 consecutive readings in this category, we know it's serious and we know there is something going on.